I think there's certainly opportunity in the payment integrity industry, the relationship between payer and providers to improve communication when it comes to claims and overpayments. There's a lot of tools and services offered in the industry today, but a lot of those fall flat without the support behind it. And I think we certainly feel the frustration from the payers and the providers, both sides of it, because we work with both sides, we contract with both, that the solutions in place today aren't acceptable and don't work for them and often causes abrasion between the two parties. Well, I think there's a lot of wasted time, whether it's follow-up via correspondence or phone calls or a system that somebody's logging into and submitting a claim, but they're not getting a response, they're not getting a timely response. It's just wasted time, it's wasted resources, which ultimately is cost prohibitive to all these organizations to spend time in those systems or in those processes that don't get the results that they're set up to get. I think in engaging with the right vendor or firm, or finding somebody who does have a relationship on both sides and has an interest to be able to help both sides and both parties get resolution. I think that's where it starts. And having a partner they can trust, that they know is not, they're not going to be, they're going to be transparent, because they know that it takes relationships with both the payer and the provider for them to be able to do their job and be successful in the industry and what they're representing in the industry. The history between the two parties is that there is this abrasion and there's a wall that's been built between the two. And it's really because there has not been, they haven't come to the table, right? The providers are dealing with, many different insurance companies. And they all have different processes in place. Many of those processes are outdated. There's not a formal way that they can communicate with each other today, where there's accountability for the other party. So, the provider may feel like they're doing what's right, but when they don't get a response or a timely response or an effective response or a clear response. So yeah, I think the ability for for first them to come to the table and say that, admit that there is a breakdown in communication and there's potential to improve the processes in place today, is kind of the starting point. Being a vendor who contracts and works on both sides, I think gives us an advantage to be able to help facilitate that. We already do that. We work today with payers where maybe we're primarily working overpayments, right, or for the payer at the provider. But often providers will come to us and say, look, we have this list of underpayments that we can't get help with, and we'll jump in and we'll try to get those underpayments to the right people on the payer side, our contacts. If it's not our contacts, we try to get them set up with somebody. So I think there's just an opportunity to improve communication, and that's where we come in, we integrate, we become part of the staff. We're representing the payer, but we're also there to work for the provider, and we need to make sure we're delivering up to their standards, because we're essentially becoming part of their patient accounting office. Once we can kind of get into it and start to facilitate those relationships, whether it's through technology or whatever, we then can quantify it, and we can provide that feedback back to the payer or back to the provider to show them that, hey, there's results here. Your efficiency, you're picking up time, the funds are coming off your book. You've been wanting to clear these. We're able to kind of get those off the books, and the payer's happy, the provider's happy. And at the end of the day, that's what this is all about, right? That's why Trend's here.